In real life, we are seeing patients that are coming into the hospital now with the current wave of the epidemic. Virtually all of them are unvaccinated patients. So we know the vaccines work. Vaccines are the most important tools that we have to fight infectious diseases. In fact, the only infectious disease that's been exterminated, which is smallpox, happened because of vaccines. And in the United States, diseases like polio and measles have disappeared because of childhood vaccination. So we find that vaccines are the most useful way to counter epidemics, such as the COVID-19 epidemic that we're facing. So the COVID-19 vaccine in trials was 90% effective, which is amazing. You know, the flu vaccine usually is 50 to 60% effective per year, and we are happy with that. So over 90% efficacy with the COVID-19 vaccines is amazing. In real life, we are seeing patients that are coming into the hospital now with the current wave of the epidemic. Virtually all of them are unvaccinated patients. So we know the vaccines work. Originally, there were trials conducted with over 30,000 people for Pfizer and separately the Moderna vaccine, which revealed that these are very safe vaccines. But since release, there are other monitoring systems that are in place, and I'd like to point out some of them. There's an app called vSafe that the CDC released, which anybody that gets vaccinated can use. And if they have a side effect, they can put that into vSafe. And if it's severe, the CDC contacts you, and that helps in monitoring for side effects. The other thing from my perspective as a physician, there is a system called VAERS, or Vaccine Adverse Event Reporting System, which is online and which is very easy to use. And we are encouraged to use the VAERS system for any side effects. So cumulatively, all this monitoring has led to all the data that we need, which is the vaccines are extremely safe, and I have no compunctions about these vaccines at all. Children that can be vaccinated, that are over the age of 12, should be vaccinated. Children that are less than the age of 12 should be protected. And the best way to protect them is to cocoon them by surrounding them with people that are vaccinated and decreasing the risk. So if all the teachers and caregivers in the school are vaccinated and they wear masks, then the children are protected. I think it's important for their social development and intellectual development to be back in school. So I would encourage children to go back to school with appropriate precautions. If you're vaccinated, you can still get breakthrough infection. And even though it'll be a mild infection in you, you could spread it to other people around you that are not vaccinated. And therefore, it's important to wear a mask. The other thing to think about is the vaccine is 90% effective, but not 100%. So even though you've been vaccinated, it's prudent to wear a mask in situations where you think you'll be surrounded by patients or people that are uninfected and may carry the virus. Now, it's different at home. So let's say you're a family and you have multiple family members and everybody's vaccinated. In that situation, you do not need a mask.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos. We upload informative video content every week.